I'm Dr. Suman. I'm a consultant pediatrician at Ankura Hospitals. There are a lot of concerns regarding parents to how to start a weaning diet for small children, when to start, what to start, and what are the healthy foods to give so that child's diet starts off in a healthy way once they come down on the milk diet. So what I would recommend is, first is when to start. My recommended time would be always between 4.5 months to 6 months. If the child is a term baby, getting mother feeds on time and the child is feeding well, then I would recommend once the baby reaches 6 months. If the baby is not gaining adequate weight, they are having, if the child is on formula feeds and the child is having difficulty latching on, then I would recommend to start on cereals or weaning foods at 4.5 months, not earlier and not later also. And how best to know when is the right time to start? Look at the child's position, whether the child is in a position to hold his neck properly or not, whether the child is in a position to push the tongue out. These are two things which you need to realize to start weaning food for the child. These are two things to keep in mind. Next important aspect is what to start. We would recommend as pediatrician as natural as possible, because that is natural food is the best food. So we would recommend home-based cereals to be the first food to start for children, because they are easy to digest, they are easily available, and they are basic staple diet. So I would recommend a rice-based diet for the children to be prepared. There's a thing called home-based cereal. We also call it as Uggu in Telugu. The cereals which are mixed with pulses. So you can have 2 parts cereals and 1 part pulses for these children, which can be given gradually, mixed with water, never mixed with milk. This is something which can be started, followed by 1 to 2 feeds of these mixed cereal feeds and pulses, followed by fruit feeds, which can be mashed rather than juices. So these fruits can be mashed properly and then given it in direct formats. No added water, no added sugar, no added milk to it. This can initially you start off with mixed cereals and pulses, 1 to 2 feeds. After 1 week, you start fruit feeds, which can start at 1 feed, then push it up to 2 feeds. Then in the 3rd to 4th week, you can slowly start on vegetable feeds, such as carrot purees or tomato purees, which can be given as a single feed. So total on the whole, the child will be getting 5 solid feeds, which can be started gradually. Look whether the child is accepting it, tolerating it well, has no issues once you start it. And go gradually and start building it up. The solid feeds should be started 2 hours after the child gets up, and the last feed should be given 2 hours before the child goes to sleep, for having better digestion and not having any issues with the digestion. So this is what we would recommend as far as weaning diet, how to start off with. Slowly after 3 to 4 weeks, you can change the amount of cereals and pulses, and then the fruit, what fruit are you giving, whether it's apple or banana, you can keep changing it, one time in the morning, one time in the evening, and the vegetables also can be changed gradually. So every week the child will be getting something new, so child's excitement keeps on going, and we'll be in a position to give him good diet every week, and we will also know what is good for the child, whether the child is tolerating it or not. These are all aspects which can be answered. Thank you.